Before having this fully integrated workflow with the PrimeScan and SureSmile, we were taking traditional polyvinyl impressions and sending them to the aligner companies and waiting for the aligners to come back, which can sometimes take several weeks. But now with the PrimeScan and with SureSmile, we're able to deliver these aligners much faster because we can make the aligners here in the practice. So a lot of our patients appreciate that, they appreciate the efficiency, and it's really taken our practice to a different level when it comes to aligner therapy. When I first started using the OmniCam, the original ortho software came out, and as that product evolved and as that software evolved, SureSmile came into the picture, and I was able to be introduced to that product very, very early on. But now that they have an aligner product, it really made me feel very excited about it because they have the history and they have the background and the knowledge to be able to deliver that type of treatment. The first thing we typically capture is a 3D scan of their jaws. That's with our cone beam Galileo scanner. After they've captured that scan, we take a series of photographs and intraoral radiographs, but then we also capture a full arch scan with our PrimeScan. Being able to integrate the cone beam data, the 3D data of the PrimeScan, and use that for treatment planning with SureSmile is a very powerful tool. That three-dimensional data is then paired with our PrimeScan data to create the most ideal treatment planning sequence with SureSmile that's available. Patients expect efficiency, accuracy, and comfort when it comes to their aligner therapy, and those are all things that we can deliver using our PrimeScan and using SureSmile. When the aligners themselves are made from a very optically clear Essex aligner plastic, which is very accurate when it comes to the fit and the movement of the teeth, but it's also very clear. One of the best things about SureSmile is the ability to have full control over the treatment, meaning I can upload the records, the photos, the scans. I can even integrate it with 3D images from our cone beam, and that helps me with the planning. In the past, we'd have to take analog impressions or use a scanner that would then upload to a different software that had to convert the files, and it was very cumbersome and it wasn't seamless. Today, with the PrimeScan and SureSmile, everything works together seamlessly. Within minutes, I have access to all of that data where I can start treatment planning the case and planning where the teeth need to go and showing the patient the simulation and all the steps that are involved with it. So that gives me a lot of control, being able to show the patient the steps all along the way. When it comes to a dental practice, our biggest source of overhead is chair time. And if I can eliminate chair time or minimize chair time, it helps me not only run my practice more efficiently, but it helps my patients be more comfortable and more open to receiving treatment. It's an exciting time in dentistry because we're entering a new phase of aligner therapy. Gone are the days where we had to take traditional analog impressions, polyvinyl impressions that were messy and uncomfortable for our patients. Today we can capture full arch scans that are highly accurate, highly comfortable for the patient in under a minute or two. And if I can eliminate chair time or minimize chair time, and I can minimize the costs for me to deliver this type of treatment, it helps with the return on investment on this equipment that we're investing in our practice. So now I can deliver aligner therapy for much less than I did before, which then makes it more affordable for my patients, and it makes it more profitable for us as practice owners.